Thank you everyone. Thank you for inviting me. I find that in terms of these conferences, it's very overwhelming in terms of the amount of information that is delivered. So I'm going to ask you only to remember 4 things from this talk. The first is, I want you to think metaphorically what we're doing. With Sculptra, we're planting tiny seeds in the skin to stimulate collagen production. That's number 1. Number 2, Sculptra is not a traditional filler. It's poly-L-lactic acid, and it works to regenerate collagen. Number 3, the type of collagen that it works on is collagen type 1. And number 4, the results of this last up to 25 months. So if you remember those things from my talk, I will be very pleased. So I'm a dermatologist. I've been practicing now for 25 years. These are my disclosures. So this is the overview. I'm going to talk about what actually is Sculptra, the mechanism of action, the supporting research, and I will tell you exactly how I use it in my practice. So what is it? It is not a filler, it is a biostimulator. It leads to collagen production, namely collagen type 1 as well as type 3. In terms of the labeling, it's on label for use for the treatment of depressed areas. So we're looking at volume loss, atrophy, folds, wrinkles, and scars in patients over 21. It has been around for a long time, and I remember using it in patients with lipoatrophy with HIV. So it has been around for quite a while. In fact, it was first discovered in 1932. It is not a new drug. It was initially approved by the FDA in HIV patients for lipoatrophy, and then it was approved in Canada for the use, aesthetic use. At that time when it was approved, we started to use it in a different reconstitution volume. I will talk specifically about that after. There is a new reconstitution volume, and it is now 9 cc's, and I will refer to that. And I will tell you exactly, as I said, how I use it in my practice, where I use it, why I use it, and why I think it's very effective in patients who have volume loss as well as rhytids. How is it delivered? It comes as a clear glass vial. It contains poly-L-lactic acid as well as sodium carboxymethylcellulose and mannitol. So what exactly is PLLA? It is biodegradable. It's biocompatible. It's a synthetic polymer. It's been used in orthopedic surgery for many years. There is a carrier for sustained release of the bioactive compound, and it's also sold as suture material. It's actually in Vicryl. So what are the other components in it? Carboxymethylcellulose. We use that as a suspending agent. And the mannitol is also a component that's present in Sculptra, and it's basically used to produce a stiff, homogeneous cake. So this is important. How exactly does it work? Once again, it is not a traditional filler. It's not an HA. It stimulates collagen production. So we inject, think of it again as metaphorically, you're injecting tiny seeds into the dermis of the skin, and they're producing collagen. So you're getting a sustained effect up to 25 months, and you will not see an immediate effect. It works deep in the dermis to stimulate the replacement of lost collagen, collagen type 1 and 3. As the collagen is created, it produces a structural foundation, and the result is an improvement in fullness of the skin and a correction of volume deficiencies, so deep wrinkles and folds. This improvement lasts up to 25 months. Histologically, what do we see? In A, you see the aggregates of giant cells and histiocytes and collagen. And then in B, you see these are the microparticles of PLLA. If you fast forward to 30 months, you see a replacement of the PLLA with collagen type 1 and collagen type 3. Why would we use it? When we have all these HAs out there, why would we use Sculptra? Because patients want to look natural, they want to look fresh, they want something other than line and wrinkle treatments, and they want something that lasts. Practically, what I want you to think about for this product is you can use it not to replace volume. Specifically, you are using it, for example, a perfect patient would be those patients who have very fine rhytids, the ones you don't want to chase after with an HA, but you want to improve the entire facial, that area. Think of it as an area treatment, not a spot treatment. So why is this important? Because a survey was done with 383 women between the ages of 35 and 69, and they asked them what exactly they wanted. 75% of these women, 3/4, preferred gradual results that lasted up to 25 months rather than immediate results lasting 1 year. And this is interesting because it compares the two. Now, in my practice, it's not an all or none thing. I use both. So what we see is that a filler, as you know, you see an immediate effect lasting up to 1 year. The prime benefit of that filler is to fill wrinkles and add volume. Conversely, for Sculptra, we actually see an improvement in native collagen type 1 and type 3 production, and this gives a natural and gradual effect for 25 months. We can target the entire area. It's a regional treatment, not a spot treatment, and it can address a large area with multiple areas, and it has very excellent spreadability. And I'm including some treatment videos as well. Now, the aesthetic, in 2014, there was a pivotal study, and it compared the use of Sculptra with Cosmoplast, which actually is collagen. And what it found is that if you look at the wrinkle assessment score of Sculptra versus collagen, you see the collagen improvement lasts up to 13 months, but look at the Sculptra improvement, 25 months. That's over 2 years of improvement. In terms of adverse events, there was localized swelling and redness, but significantly less in the Sculptra group than in the collagen group. Once again, long-lasting results. In terms of investigator assessment, this lasted 86.3% of investigators saw an improvement 2 years after Sculptra. In terms of patient satisfaction, 80% of patients rated the results as good or excellent at 25 months. Okay, so this is the most important thing. This is exactly how we use it. So this is a patient, typical patient in her 30s. She has very little bone resorption, but she's beginning to get fat pad deflation and some skin laxity. So we would use this in the lateral aspect of the face. The other key pearl I'm going to give you is how much to use. 1 vial per decade of life. So for example, if you have a 50-year-old patient, you're looking at a total treatment volume of 5 vials, not in an individual treatment session. You can spread that out. But in general, you would tell them this is a program. You will need, because you're 50, you will need 5 vials over the course of your program to give you results. So let's look at another patient. This is a patient in her 40s. We know in your 40s, you actually start to get maxillary bone resorption. And so she's starting to get the beginning of bone resorption. She has deflation and descent of the fat pads and moderate skin laxity. So these are the areas we want to concentrate on for her. The temples, the cheeks, and then you also want to put a little bit in the piriform fossa and the mentum. As we go into the 50s, you have moderate bone resorption now, accentuated sagging. You have more aged skin. So you're going to, once again, you're going to use more. You're going to use 4+, so I would say 5 vials in total. You're going to inject in the lateral and medial planes and then the superficial and deep planes. I will show you exactly how I do it in terms of where to inject. So what do you see? So this is a patient before and after. 1 vial per decade of age, and the average number of sessions is 2 to 3. I often will spread it out into maybe 4 or 5 sessions, but you can do 2 or 3 sessions depending on the patient's timeline. Okay, what do I use and where? In temples. So your typical patient between the ages of 40 and 60, I will start with using a periosteal injection. I will inject down onto bone, and I will inject approximately 0.2 cc's per tract, and I'll show you how. In terms of the temples, inject down to bone, 1 centimeter apart, 0.2 cc's per injection site. I will also layer it, so I'll put a periosteal injection, and then I'll layer it with a cannula. The malar region, once again, I will do a periosteal injection on the zygoma, and then layer it as well subdermally. Preauricular and jawline area, I really like to use in older patients at the corner of the mandibles. I'll put a depot there, 0.2 cc's, and then once again, I'm going to layer it subcutaneously. In the submalar area, you can go cross-hatch into the nasolabial fold. Do not go past the nasolabial fold. In terms of injection sites for Sculptra, it's not in the T-zone. Stay lateral. As we get bone resorption, we know that with bone resorption occurs in the maxilla and also the mentum as we get older. You want to put some depot in these areas. Remember, you stay deep. This area in the piriform aperture, remember, you have an angular artery that stays there. You need to go down to bone in that area. That is the safest area to inject. Now, we've done our bone, our subperiosteal injections. Now we have to go more superficial. So we're going to do subcutaneous injections. For these, then I switch to a cannula. So I use a needle and cannula approach. I will do my bone, my supraperiosteal injections with a needle, and then I'll switch to a cannula. And the cannula, remember, you're using a fanning technique. You want to improve the entire region of the skin. It's not a spot treatment. You want to improve everything on the skin. So then I'll switch to a cannula and I'll fan that product out in the entire surface. You can also do subdermal injections. So I like to layer. Remember, supraperiosteal, subdermal, and then more superficial. The important thing to note is when you inject this product, you do not want to see the product. No blebs. You want to be deep enough. You do not see a bleb. You are planting seeds in the skin. You plant the seeds. You see the patient once a month, complete the number of vials they need, and then you wait for the seeds to grow. And when the seeds are growing, they're actually producing collagen type 1. So this is a fun thing. This is exactly the fanning technique. You can see this. So look at the cannula. It is deep. You are not seeing papules. In each thread, you're putting approximately 0.2 cc's. Fanning technique. You're planting the seeds of Sculptra, and those seeds will sit there and produce collagen type 1. Stay deep. You can go right past the mandible. This is almost into the neck. And very nice linear threads with 2 injection sites. You can actually complete the whole half of the face, including the temple. And that's the beauty of it, that you don't need to do serial punctures. Patients love it because they're only going to have 2 areas if they do bruising. Very nice treatment. Remember, you're planting the seeds. So practically what would I do? I'd see the patient. I would do volume enhancement with my HA filler so they get an immediate effect. And then you're planting the seeds, and up to 25 months, those seeds will continue to grow and produce collagen type 1. Now think about this patient. This is a younger patient. Think about if this patient is in her 50s or 60s, and she has those very fine rhytids. You don't want to chase them with a traditional filler. This is perfect. You want to treat the entire surface.
How much volume per line?
How much volume? 0.
Per line. Per thread. 22.
0. So I'm going to show you. I'm talking about 0.2 cc's per line, but I'm going to show you because it has to do with obviously the reconstitution. But think in your head, 0.2 cc's per thread. You can also use a needle. I'm putting this in just to be complete. I prefer not using the needle just because of the bruising, but you can actually use a needle. Let's say you have a couple little spots that you want to get, or you want to make sure that you've, some rhytids that you want to over-treat as well in that area. You want to treat again. You can do that. Remember, you do not want to see a bleb with this product. You need to stay deep. If you do see a bleb, so if you see a little nodule, stop your injection, massage, and get that nodule down again. Okay, this is an easy way to remember where not to inject. It's almost like when we talk about the T-zone for acne, that's the area you do not want to inject Sculptra in that area. So stay lateral. So avoid, you can do the nasolabial fold. So if you look at the maxilla here, the nasolabial fold does not include, you can inject into the nasolabial fold. You could do a cross-hatch technique, but do not inject past that nasolabial fold. And definitely not around the eyes. Okay, so the reconstitution, we're going to talk about this for a second. There were issues in the past with clogging. So there is a new reconstitution volume. How I do it is 5 cc's of sterile water, shake that, and then you can add another 3 cc's of sterile water. Into that, you can also add some xylocaine to make it comfortable for the patient. By doing so, you're going to increase the comfort to the patient, and you will decrease the risk of clogging. There's another little trick that I do when I set up my syringes. I'll have them all set up in front of me. I'll shake the syringes. I'll have someone, my assistant, shake this, take that syringe and just keep those syringes moving, so you keep it moving. If you do clog, then you can stop and just express the product and then go back to injecting. I inject with this 25 gauge cannula, and I find that with respect to that reconstitution and in that technique, the risk of clogging is very, very low. The addition of 1% of xylocaine makes it a lot more comfortable for the patient. And the nice thing about now the reconstitution is we know that the sculpture can be used immediately. In the past, we thought that we had to let it sit, and then what would happen is you would mix up your sculpture for the patient in 3 days before, and the patient didn't show up or they canceled, and it was an issue. It's not an issue anymore. You can actually mix it and immediately use it. So what is better now in terms of the labeling for this drug? The addition of lidocaine, either 1% or 2%. The larger volumes make it easier to use. Remember, we're using it as a layering technique. Start from the bottom, start supraperiosteal, and work up more superficial. And you can use it immediately after reconstitution. And this is just a study that was done looking at analyzing immediate use after reconstitution and waiting 3 days, and they found that there was no difference in viscosity and the pH. It can be used immediately after reconstituted. And this is just the study showing this. Another little pearl for the use of this product: when you go to use it, take the vial and turn it upside down. Okay, you see there's a little foam at the top, so if you turn it upside down, the foam goes to the top, and then when you extract it, you won't get the foam, because the foam is just the mannitol and methoxycellulose. You actually want that lighter part. So turn it upside down, stick your needle in, and then you can draw it out. I drop all my syringes. I have them all in front of me, ready to go, so that you're finished drawing it up, and then you can get right to treating the patient. My assistant will move and rotate those syringes to keep them moving and decrease clogging. And this is just some of the tips I've talked about already. After reconstitution, keep it moving. Agitate the product. Drop the suspension, tip it upside down to do it. And then after you do it, expel a few drops of air and foam, so you're ready to go. It's already primed. If you do get a clog, stop injecting and just change the needle. I hardly ever get clogging now. It's a very smooth technique. And the nice thing about it, it takes me to do a whole face probably about 15 minutes. It is incredibly fast, incredibly easy, and patients love it. This is key. You're putting seeds in the skin. After you put them in, I tell the patients they need to massage that area 5 minutes, 5 times a day for 5 days. And I show them, so what I'll do, I will inject it. I'll take a little bit of ultrasound gel or whatever you have, even a moisturizing gel, and I will, after I inject them, I will massage that patient myself. And they tell me that actually is the best part of the treatment. That's what they like the best. But they will learn about how much pressure to use and how often to do it. And this decreases the risk of nodules, and touch wood, I haven't had any issues. Adverse reactions are edema and bruising, as you expect with any injection. Once again, by using the technique I'm proposing, in 2 injection sites using a cannula, you can do half a face. There is a risk of granulomas. I have not seen those. If you do see any nodules or papules, massage them. They are self-limited if you do get them. And with any injectable, as we know, there's always a risk of vascular compromise, which is why I like to use it very dilute. Causes of nodules have been replaced with the new dilution. We don't see that anymore. It's important for the patient to massage. You only want to inject the 0.2 cc's of product per linear thread. You don't want to inject too much product in one area. Stay deep. If you see a nodule, you're too superficial. And I do not inject in less than 1 month. Okay, so let's say I want to inject 5 vials for a patient. She's 50. I will see her 1 month apart for 3 to 5 sessions. I do one. You can do it every 4 to 6 weeks. I do it every 4, 1 to 2 vials per session. And once again, you want to plant the seeds. You get a gradual stimulation of collagen type 1, and you will get changes in the skin that are a global improvement, not a spot treatment. You'll see a global improvement in rhytids and fine lines. And these results are durable. They'll last up to 25 months. So let's look at some pictures. This is a patient who is 42. She had 5 vials over 4 sessions. And this is her after. So even though it's not a traditional filler, you can see an improvement in her volume. And the nice thing about this product, once again, it's an overall improvement. Think of the cheek. You are treating the entire region from the temple down to the jawline, that entire surface you are treating. It's a good question. In that cannula, you can inject down to here. The issue with the neck, it's a different cosmetic unit than the face. It is very unforgiving if you have a nodule. So you have to be very careful. So I'll inject a little bit below the jawline. I won't go down here. It is off-label. If you have more experience and you take that product and dilute it, it's possible, but I would be very careful. Yeah. So once again, you're seeing a global improvement. This is a patient who only had, she's 66. She probably needs a facelift, but she didn't want to do that, and she has a global improvement. So key pearls, once again, do not overfill. Avoid injecting into high-risk areas. If you are going to inject in the piriform, in the fossa, make sure you're deep. You go down to bone, you aspirate, and then you inject. Most of the side effects are injection site related with respect to puffiness and bruising. And then it's important, once again, stay deep. Stay in the deep dermis or subcutaneous layer. And I'd be happy to answer your questions. Thank you. Thank you.
Any questions? So I have a couple questions. I haven't used sculpture yet in my practice, and I'm looking into it, especially ever since that the newest studies have suggested that you can use it almost immediately. I'm always afraid of those clients that book for the day after or something like that, and they don't show up, and that's an expensive vial that just went out the door. Maybe I'd use it on myself or my wife. I don't know, but for me, it's how vigorous of a massage do you have to do? Is it mild, medium, or hard?
It actually is comfortable. As I said, the patients love it because it's like the best part of the treatment. So it's firm but not painful. And I think practically, you do your neuromodulators and do your HA fillers, and it is great for a global improvement, especially in those patients who are older. They have the really fine rhytids that are difficult to chase with a filler. They're really difficult to inject in that line. So you get a global improvement, and it's great on bone. Like if you inject it right on the zygoma, like think about the areas you want to lift. That was my second question, actually.
So why is it that you'd go so deep if you're trying to stimulate collagen in the skin?
Because you actually get supraperiosteal. If you plant it there, you'll actually get collagen regeneration kind of up from that product. Yeah.
There's a question over there.
Yes.
If you can shout it out so we can hear it.
Sure. Yes, 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 and yes. So, okay. So the question is, do you deep on bone and a subcutaneous same day? The answer is yes. How many vials per treatment? 1 to 2. Because remember, that vial, you're actually stretching that vial sometimes into 12 cc's. Like if I'm concerned about a patient, the type 1 patient who has very thin skin, I'll hyperdilute the product. So that means if you're doing 12 cc, you take one vial, becomes 12 cc's by the time you actually hyperdilute it. So that's now 2 vials, which is 24 cc's. So that's, you're getting to a lot of volume in the skin, just, and a lot of it is sterile water, of course, but you don't want to have a lot of edema. So for patients who are kind of picky and fussy, I will just do 1 at a time. If patients say, I have a week, I'm off, then I'll do 2, especially for an older patient, because it's a 50-year-old patient, you're looking at 5 vials in total. So they say, I'll do it in 3 sessions, so I'll do 2, 2, and 1. You just have to keep in mind that volume that you're injecting. And then in terms of how I do it, I go deep first, place everything on bone, temples on bone, zygoma on bone. I'll do kind of the mandible on bone, the mentum on bone with a needle, switch to a cannula, and then you're going to do, on top of everything, you're going to put the cannula, just a subcutaneous layer. Yeah, and once you start to use it, you will never stop using it because patients see the improvement and they like the look of their skin. They like the quality of their skin with this product.
How long does it take until you start seeing visible results?
It's a good question. Usually around 8 weeks, you start to see it. Yeah, and that improvement, as I said, lasts up to 25 months because you're planting seeds. You're actually regenerating new collagen. And then in terms of talking to the patient about it, a lot of patients like it because they like the idea of it being quote-unquote natural. It's their own collagen that they're laying down. So for those patients who might be averse to traditional fillers or neuromodulators even, they like the idea of their own collagen. And the PLLA dissipates. So as the PLA dissipates, you're getting new collagen.
What I really like about the Sculptra is that for newer providers, they kind of stay away from it because it's not dissolvable, but it's in theory safer than anything out there because it's like water. It's almost impossible to clog an artery. In theory, we always say it's never 0%, but it's a very safe option. Anybody else? Yes, go ahead.
They are saying about the fact that using Sculptra might get your later injection with aging more difficult because of collagen. Do you see that in your practice?
No, because remember the amount of it's almost like by the time you've diluted it, these are tiny droplets. And the tiny droplets stimulate collagen, but only in like certain areas. So I actually use it as an adjunct. So do your neuromodulators, do your HA fillers, and then use this on top.
Okay, so I know there's a few more questions out there. It's a hot topic, and I really appreciate it. If you can, please upload the CBAM Congress app profile in your Instagram. Write it in there, and Dr. Kellett will be able to answer it within 12 hours.
Oh, good question. Okay.
Price of the session was a question.
Price in session. So I charge $1,500 per session. And that way, and I don't, whether I use 1 vial or 2 vials, what I like to tell patients is this is your program, this is how much it is, and regardless if you use 1 or 2, they're doing the sessions, the whole thing. I think the important thing, though, in terms of talking to patients about it, it's not a 1-session treatment. So often some people take that and they actually will sell a package of all 5 vials at the beginning, and then the patient, it's a program, it's not per treatment.
So if it's the 5 together, how much is it?
So it'd be $1,500 per, yeah, exactly.
Terrific. Thank you very much.
Great, thank you, thanks.